This is Lindsey Williams. Stand by for news about COVID recovery. That's where I had my greatest problem. Yes, I did contract COVID. Afterwards, I could not get over it. Why? I had to go get professional help because of what it might have done to my heart, or my lungs, or some other part of my body. People don't realize how dangerous COVID is. Please give them a call. The toll-free number is on your screen. BioCare Hospital and Wellness Center. Right into the hospital, 1-800-262-0212, and ask for a special consultation with a doctor. They will gladly talk to you without charging you. Where today do you find a doctor that cares like BioCare Hospital who won't charge you by the minute for a consultation? Well, they did. They helped me through it. I came to BioCare Hospital. I would have never gotten over COVID if I had not. And I asked Dr. Rodrigo Rodriguez, the founder and medical director of BioCare Hospital, I asked him, Doctor, what is it that you can trace all disease back to? Is there any one thing that you can say is somewhere in the basis of what causes disease? He didn't hesitate for a moment. I said, well, what is it? He said, stress. Well, we all have been placed under horrible stress as a result of a worldwide COVID outbreak. And then when you came in contact with it, immediately you contracted it, as so many people did. So I would like to ask the professional himself, Dr. Rodriguez. Dr. Rodriguez, why should a person choose BioCare Hospital for their COVID renewal?
Normally, when we have a patient that has had COVID, of course, we do a full physical examination, a full medical history. We review things very carefully. We look at inflammatory levels. This is very important because I'm telling you that one of the big problems is going to be inflammation, but fortunately, we can check what is the level of inflammation. If you don't do that, you're missing the whole point. If you're trying to address just the symptom, you're not doing your work. You don't know your art. You don't understand what you're dealing with. We can measure those things. All you need is a blood sample and to see what's the level of inflammatory markers. And those inflammatory markers are very accurate. And they're going to take you by the hand and say, this is what we have to do. This is how intense we have to be. This is how careful we have to be. This is what sort of protection we have to give this particular person. If you don't do that, once again, you're not doing your job. You don't know how to do it. So by doing that, I can tell, I think I have to be very careful, and as those levels improve, then I can take a sigh of relief and say, I think that what we're doing is working. I think that body is responding well. I think that person is going to be recovering and continue to recover. And then I can tell you. Now, I told you repeatedly from the beginning, this is going to take time. Don't think in how I felt yesterday. Think of how I felt a week ago. Because these things improve slowly, but should improve surely. You should be getting better and better. And if you do everything you have to do, that improvement will come and you will be able to feel it. But you will feel it week to week, not day to day, because it takes time. But doing what we have done with you, doing what we're doing at BioCare is going to speed the process. Some people have all these symptoms for months and months. I know people that have had a year since they recover from COVID, and they still have serious problems. And I have many people that come back smiling and just say, "Doctor, you were right. I feel a lot better. I'm becoming myself again."